Hi, my name is Dr. Carver. Today I'd like to talk with you about vaccines. Vaccines are an important part of preventive medicine for both our dogs and cats. We have core vaccines for our dogs and cats. They include distemper combo, it has distemper, parainfluenza, and parvo in it, rabies, everybody's familiar with that term, and then bordetella. And our cats, we like to give them what's called FARCP, which protects them against upper respiratory series and rabies. That kind of composes our core. So we do branch out in other vaccines if we have dogs with other lifestyles. So if we have our pampered pooch whose paws never touch the ground, we're really not going to be vaccinating them for tick-borne diseases like Lyme disease, or some of our diseases that we can pick up from livestock like leptospirosis. With that in mind, the reason why we vaccinate is that we want to have the immune system pre-exposed or pre-trained so that if they are ever exposed to these diseases, they can mount a quick and efficient immune response and prevent disease, or if the disease is not 100% prevented, the disease process is more mild and not as severe. So outside of our core vaccines, we have other vaccines that we'll give depending on the animal's lifestyle. So for our dogs, if they're out hunting and they're going to be exposed to ticks, we certainly want to pre-vaccinate them for Lyme disease. If they're going to be running with livestock, or they're going to be in a wetland area, if they live in an area that gets flooded, or if they live in an area that previously was a wetland and was developed within the last 5 years, which is pretty common here in Florida, we want to protect them against leptospirosis. For our kitty cats, if they're going outside, we want to protect them against FELV, or feline leukemia virus. So they'll get that on an annual basis. So why we want to vaccinate is so that we pre-expose or teach our immune system what these diseases look like, so that if and when our animal is exposed, they can mount a rapid and efficient immune response to fight off the disease, so that hopefully the animal never gets the disease. But if they do get the disease, that they get a more mild case of it and can sail through the situation with no problems. All right, so Rosie is going to be getting her bordetella, which is going to protect her against kennel cough, her distemper combo, which is going to be distemper, parainfluenza, and parvo, and rabies. Okay, so now Rosie's had all of her puppy vaccines. She had her annual booster, which should be good to go till next year when she'll need another heartworm, fecal test, bordetella. And it'll be 3 years from now before she needs her rabies and distemper. So yay for Rosie, and yay for your dog to keep up with all of her vaccines and services.